I think it's an opportunity to explore a curiosity. I said to her, "What are we thinking about with regards to a major in college?" And she said, I couldn't think of anything besides the sciences. And that was kind of a shock to me. She's always been gifted in the languages. So, I think the way that we handled it and spoke to Anna about it, it's like you have a curiosity for healthcare. What does that look like? Do you want to be a nurse? Do you want to be a physician assistant? Would you like to be a doctor? And certainly we said to her and encouraged her, you don't do something because your parents want you to do something. It's more of a vocation or a calling. So that was really important. This was an opportunity for us, my wife and I, and Anna to say, either ruling it in or ruling it out. So it was kind of a special moment. But it was just neat for her to be with me at a different level. There are different dynamics in your own house, but to have her with me at work was something special. And personally, because there she is talking to the docs in the doctor's lounge and the nurses, and it was real special. And I think she was reluctant, and she'll say this to you as well, to even come to the emergency department. She wanted to, quote, appease Dad and come to the emergency department. So she ends up coming, and you should ask her, and she spends, I think, most of the day there. And I took her around, and we saw a few patients together, and then she had heard I was putting in a central line, which is an IV that goes into the neck, and she stood there, and she was very much into it, and I kind of calmly spoke to the patient, explained what we were doing, and then the other nurses and volunteers were there as well. And I think it was a special moment. I think she went home, I went home that night, and I said, "Well, how did Anna like the experience? What did she say?" And she said, "I got to tell you, what I saw Dad do was very cool, and it was awesome." And then she said, "But don't tell him." so that was kind of neat. So it was a nice experience. And what she also said too, which I think is very important, is that she now wants to be a nurse. I said, "Well, you want to be a nurse? What about being a doctor?" Of course, we all have our own biases, and she said, "Well, the truth is that nurses are the ones who spend all the time with the patients. You guys come in and out, physicians come in and out, but it's the nurses that have the relationship." And I got to tell you, she's right. Right? There's nothing like having a nurse, quality nurse with you. And I think sometimes we don't remember our doctors, but we don't forget our nurses, do we?